You know, when medical care moves out of the hospital and into your living room, things get really personal. But how do you actually know if you're getting the best, safest care possible? Well, it turns out there's an official rule book for that. And today, we're going to open it up and see what it says.
I mean, it's a really important question, right? If there's no front desk to walk up to, no administrator down the hall, who's setting the standard? Who makes sure that every single patient in every single home gets the same high level of care and respect?
Well, the answer is an organization called CHAP. You can think of them as the national referees for quality in home health. They're a nonprofit, and they're the ones who create the gold standard for agencies to follow. And here's the really important part. Their standards are approved by CMS. That's the Centers for Medicare and Medicaid Services, which means they have some serious authority.
So how does this rulebook actually work for you? We're going to walk through the whole journey. We'll start with the gold standard itself, then cover your rights from day one and the care blueprint made just for you. We'll even meet the expert care team, uncover the safety net you don't see, and finally, see how it all comes together to put you in the driver's seat.
First up, home care's gold standard. And look, this isn't just some boring list of rules. It's a whole framework designed to change home care from just a service into a real partnership. To make this all make sense, we're going to follow the journey of a patient. We'll call her Eleanor, and see how these standards actually apply to her step by step.
All right, let's start where every care journey should always start, with your rights. Before a single medical task ever happens, the CHAP rulebook says you have to be given the tools to be your own best advocate.
So for Eleanor, the second an agency agrees to take her on as a patient, her journey doesn't kick off with the treatment plan. No, it starts with a conversation all about her rights, making sure she's empowered from that very first interaction.
And the rules are super specific about how this has to happen. It's not enough to just hand Eleanor a pamphlet and walk away. The agency has to explain her rights out loud in a language she actually understands. Then, they also have to give her a written copy she can keep. It's a two-step process that's all about making sure you really get it.
So what are these rights? Well, they're pretty powerful. The right to participate in your own care planning, that means Eleanor has a direct say in her goals and how often she gets visits. The right to refuse treatment, that puts her in complete control of her own body. And this one is huge, the right to voice complaints without fear. That means there's a system in place that is designed to listen and protect her if something just isn't right.
Okay, with those rights firmly established, we can move on to the next phase, building out that personalized care blueprint. This is absolutely not a one-size-fits-all kind of plan. It's a detailed roadmap tailored specifically to the patient.
And this whole process runs on a pretty strict timeline, so nothing falls through the cracks. As soon as Eleanor gets a referral, a clinician has to visit for an initial assessment within 48 hours. Then, within 5 days, a much more detailed, comprehensive assessment has to be finished. And this isn't a set-it-and-forget-it deal either. That plan has to be officially reviewed and updated at least every 60 days.
These two documents really are the heart of her file. The assessment is the what is. It's all about gathering information, everything from Eleanor's medical history to her personal goals. Then the care plan is the what to do. It's the action plan that turns all that info into doctor's orders, visit schedules, and really clear, measurable goals.
So, we've got the rights, we've got the plan, but who's actually going to carry it out? This brings us to the people coming into Eleanor's home, her care team. And you better believe the CHAP standards have a lot to say about who these people are and what makes them qualified to be there.
First off, it's not just one person. The standards require a collaborative team. That means you have nurses, therapists, social workers, and physicians all coordinating together for the patient. This makes sure that every part of Eleanor's well-being is being looked after, not just one little piece of the puzzle.
And inside that team, people have very clear roles. You've got your skilled professionals, like a registered nurse or a physical therapist. They're kind of the strategists. They do the assessments, they build the plan, and they handle the complex medical stuff. And then you have the home health aide. They are the essential, hands-on support, the ones who expertly follow that plan to help with personal care. And just as important, they act as the eyes and ears, reporting any changes back to the rest of the team.
12. What's so special about the number 12? Well, that is the minimum number of training hours that every single home health aide has to complete every single year. It's a required commitment to keep learning, to make sure their skills are always sharp and up to date.
Okay, let's talk about something you probably won't ever see, but is incredibly important: the safety net. These are all the required processes working in the background to protect patients and make sure the quality of care stays high.
Remember we mentioned the right to complain a little while ago? Well, this is the required process that backs it up. If Eleanor has an issue, she can voice a grievance. The agency is then required to immediately investigate it, take action to fix the problem, and then officially let her know how it was resolved. It's a structured, accountable system.
14. What in the world does this number mean for Eleanor's safety? Well, it's the maximum number of days that can go by before a supervisor, like a registered nurse, has to come to her home to review the care her aide is providing. It's a mandatory check-in at least every 2 weeks just to make sure everything is safe, effective, and going according to plan.
And that safety net gets even deeper. CHAP standards require that every single agency must have solid, documented programs for these 3 core areas. This means they have to have proactive plans for preventing infections, for always looking for ways to get better, and for being ready for any kind of emergency.
So when you put it all together, the rights, the personalized plan, the expert team, and that invisible safety net, what do you really get? You get a system that's designed to turn a patient from someone who just receives care into an active, empowered partner in that care.
In fact, the rulebook itself says it best. The entire philosophy is to ensure that their concerns, values, and knowledge are incorporated into shared decision-making. It's right there in black and white. Your voice is supposed to be part of the plan.
And that's the bottom line. What we've looked at today isn't just the compliance checklist for an agency. For a patient like Eleanor, and for you, this knowledge is a toolkit. It gives you the language and the expectations you need to advocate for yourself or for someone you love to make sure you're getting the best care possible. So now you've had a look inside the official playbook for high-quality home health. You know what that gold standard is supposed to look like. The only question left is, are you ready to be an active partner in your own care journey?